The pandemic has taken a heavy toll on the mental health of millions between closed schools, lost jobs, and forced isolation from family and friends. But a study from the Kaiser Family Foundation shows 56% of adults between 18 and 24 years old have reported symptoms of anxiety or depression. Now, a national pharmacy chain is working to fill the gaps in mental health by bringing counseling services into its stores. Joining me now to talk about the impact this could have is Dr. Sue Varma. She's a psychiatrist and a clinical assistant professor of psychiatry at New York University. Dr. Varma, welcome to NewsNation.
Thank you so much for having me. I appreciate it.
So CVS isn't exactly the first place people might think to go for mental health counseling, but at the same time, the need is so great right now, and there is a convenience factor to going to your local pharmacy or drugstore. Do you think this program will help reach people who wouldn't otherwise get the help they need?
Absolutely. And there's so many reasons why we see there being not enough people getting treatment, mental health treatment, because of barriers, stigma, not knowing where to find a mental health provider, not getting access to one quickly enough, not being able to afford it. So the hope is that a program like this might be able to mainstream into its fold of medical care, routine vaccinations, routine prescriptions, everyday life. When you go to pick up, milk or a prescription, you might say, hey, maybe I could see and talk to somebody. So I really feel like it's taking away the stigma and making it accessible, available, and hopefully affordable.
And convenient, right? Americans love the one-stop shopping.
Totally, absolutely.
And I want to talk to you about a different topic, this recent CDC report that says anxiety was actually the reason behind vaccine reactions in 5 states. Explain how that happens.
We have been through so much. And just as you said, more than half of the population is experiencing increasing stress. And we're dealing with layers and layers of losses, right? Economic, job losses, people have lost their lives. We have lost loved ones. A lot of people have been sick. A lot of people are having, COVID long hauler symptoms. So all of this is in the back of our mind, right? Even a lot of people getting vaccinations might themselves have been sick months ago, right? So all of this has caused people a lot of heightened anxiety. However, we need to be able to separate some of these side effects or what people are experiencing from being associated with, these are long-term or complicated problems or vaccinations. We want to legitimize them and say, yes, it's anxiety related. And often people who are going for some of these vaccinations, specifically the J&J shot, which is one shot, they might already have had a lot of vaccine concerns and hesitation, and were already perhaps primed to experience some of the side effects because of the heightened anxiety even before they got it. Some people are feeling dizzy, nauseous, they're having palpitations, kind of what I would see in a panic attack, where your heart is racing, you're sweating, some people even vomit, some people even faint, some people feel like fainting. So I think it's really important to be able to take advantage of the 15 or 20 minutes that you're allowed to stay and linger around after the shot, and really let a professional know to say, hey, I'm feeling really anxious about this. Would you mind just keeping an eye on me, and perhaps taking somebody with you to the vaccine site? But again, we're always weighing the risks and the benefits of these far outweigh some of the smaller risks, which include anxiety attacks, not to mention the blood clots that we have seen, in days and weeks after the J&J shot.
The possibility of which probably gives people anxiety attacks. How do you know if what you're experiencing is an anxiety attack or a symptom of the vaccine side effect?
Yes. So number one, knowing that if you have a history of having what we call vasovagal or syncopal episodes, where a person feels lightheaded right after getting blood drawn, for example, or in the past, if you say, I know that I'm afraid of needles, please take somebody with you. And I would also have a conversation with your doctor. Sometimes people might be, again, this is really not one fits, for everybody, but the idea of perhaps taking a medication that might help with anxiety. But you have to be careful, because if you're driving or if you have to return to your job, an anti-anxiety medication might make you sleepy, might make it more dangerous for you to operate outside once you leave the doctor's office or the vaccine site. So having a conversation to know if you're at risk, are you primed? Do you have a prior history? And then also knowing that if you're having a reaction within minutes of either, number one, before you get the vaccine, during, or right after, the first thing I would think about is this response, an anxiety response. And I would want to monitor that person, getting them, a cool drink of water, getting them some ice, sometimes putting it on your neck. And being able to lie down can be very helpful. And again, if you're not in a doctor's office, you may not have that luxury of lying down. So really going with somebody and asking them, hey, if I need a ride home, can you take me? If I need a day off, and having conversation with your boss and your support system.
Definitely stressful times right now. We appreciate your insight and helpful tips. Dr. Varma, thank you very much for joining us.
My pleasure. Thank you.
A lot of good advice in there. Someone who got the second shot, this week. You're
Yes.
Like, that's what they say. Wait 10 minutes before you leave. Let's see if you're okay.
I think I stuck around for like an hour just to be safe. I didn't want that anxiety attack or anything else.
You're cautious.
Yeah.
I like that.